Hi everyone, welcome to our campus resource video episode 5. Today we are very happy to have University Health Services and have Mary K. Event, the Marketing and Outreach Coordinator for UHS here to help us know more about the UHS. Hi Mary, nice to meet you.
Hi, nice to meet you. Thanks for having us.
Sure, we're very happy for this time that, especially at this time, like you can take your time at this overwhelming Zoom time to really take this moment and help us to walk through these questions that international students might have. And also, I have to point out that at this time, UHS is such an important resources for us, no matter like mentally or like physically. So just to start with, can you briefly introduce yourself and also UHS to us?
Absolutely. So, I am the Marketing and Outreach Coordinator for University Health Services. My name is Mary Kay. Um, and so, basically, my job role there is outreach and marketing. So, your signage, your outward facing educational materials that you'll see on our social media. It's putting different departments together, educating students on the services that are available through University Health Services, there's a wide variety. So, I'm excited to share that today.
Thank you. So can you just start with to tell us more about like what kind of services and programs that international students are expecting from the UHS?
So I always like to tell everyone that UHS is your doctor's office away from home. So we have several MDs, DOs, PAs, APRNs on staff, registered nurses. We are a fully operational clinic. And so the services can be from a mild sore throat to just a general physical, needing to come in to speak to somebody about mental health. It could be nutrition. um, it's a like I said, it is truly your doctor's office away from home. So whatever you may be used to seeing back home at your primary care physician, majority of the time you can transfer that care here. If we're not able to see a student for a particular issue, we do have a referral department that will help connect that student to somebody in the community that can help with that.
That's a very good point because as an international student myself, sometimes I'm kind of concerned about what am I supposed to expecting from getting services from UHS and what are the following up steps. So thank you for pointing that out that there is a possible that will be referral to other departments in the communities that we can have other different kind of services and programs. But can you also tell us, is it like a free access to the UHS services? Is it like any particular requirements for international student to accept services over there?
So for students to access the services at University Health Services, everyone a student pays in their student fee a portion that will cover their health and wellness portion of it. We do bill insurances on our website. You can find through uhs.fsu.edu and our student insurance website. So that's studentinsurance.fsu.edu. And there you'll see the various insurances that we are in network with. So I'll just tell you, so if I'm walking into the health center and I need to be seen, whether it's for a sick visit or for a well visit, I will present there with my insurance information and my FSU ID. We do not collect a copay at the time of visit. We never want to deter students from coming to see us.
Mhm.
In that visit, should there be some sort of diagnostic testing, lab work, though certain things are billable, so we bill the insurance. Whatever insurance doesn't cover, that portion is then billed to the student account.
I see.
Therefore, if student is having difficulty, they can always reach out to our billing department and discuss those concerns, and they'll be happy to help from there.
Great. As far as we are talking about the insurance part and about the fee of getting services from UHS, also you touched upon on the like being referral to other departments. Is there extra fee if we're referred to other departments?
Other departments within UHS or outside in the community?
Either way.
Okay, so Within in-house, we will refer to other clinicians that are in. It may be psychiatry, it may be CHA for nutritional wellness coaching, things of that nature. And the clinicians and the nursing staff are really good about educating the students on those. And I will say our staff is super diligent and that they do not, they discuss what those fees are going to look like in all of those appointments. So nobody should be blindsided with that information. Referrals outside of UHS, that is where it does become a little complex. And that's why we have Jane, who is our referral coordinator, and she walks the students through that. There again, she also helps guide them and gathers that information. So if they have questions on, what is this going to cost me? What is my insurance going to cover for this? She is definitely a great resource in that, and she'll help them navigate that. We don't put the onus completely on the student to take care of that on their own.
Yeah, that part I really appreciate it because I do feel it's kind of a horrifying experience if I have to visit a doctor by myself without someone walking me through this whole process. Because basically, seeing a doctor is a very terrifying thing, especially for international students, seeing a doctor in a completely different medical system. So I really appreciate that school has UHS services and here walking through every process with us at this moment. So building on that, is there any specific thing that you want to introduce to us during this pandemic? Like, is other services open as usual? And what are the operating hours and stuff?
Our operating hours have remained the same. So we are Monday through Friday from 8 to 5. You can reach us by phone until 5 p.m. appointments. Our last one for the day is at 4 p.m. We have introduced our telehealth. So that's kicked off in the beginning of spring. And that has been extremely helpful through all of this because if folks don't want to leave their residence, they don't have to. They can pick up and speak to one of our clinicians. We still do have some face-to-face appointments. We do not allow for walk-ins, so appointments are required. So we would need for patients to schedule that appointment ahead of time. As far as services, I don't want to say I can't name any off the top of my head that would not be able to be accessed at this time. So we are fully operational. We've just had to make some changes with introducing the telehealth. And we hope that that sticks around. It's been a great service. I think a lot of folks have really enjoyed that piece of it moving in that direction.
Yeah, I mean, at this moment, like, we are trying to incorporating all of those like pandemic pieces, also helping our students to pass through this moment together. And at this time, let's say that telehealth is really, really helpful at this time. And also, it's really useful for us to know that there are still some in-person appointment because sometimes it just cannot be solved by using like a virtual doctor or stuff. Is there any differences between the UHS or with the like Center for Health Advocacy and Wellness or the UCC, which is University Counseling Center?
So for UHS, we are a little different in that we offer medical services. So if students come in with things such as strep throat, or we have our priority care clinic that is kind of like our urgent care clinic. And so if students need IVs for or sutures or things of that nature. We work in tandem with CHA and with UCC for mental health services. CHA does offer a few more additional, their wellness coaching, sexual health, things of that nature. And then we obviously, work together as teams all the time to see and provide the best care for the student. I know that we collaborate on many levels, which is great to have that across campus. So if one partner is not able to do it, we are definitely reaching out to see who can help that student and how, and that way they can get the best care.
Yeah, like after interviewing every like representative from different department, I do feel like there's a very strong connections between apartments, but actually those are kind of the hidden part for international students because they didn't see that part at all and they didn't see that there are so many connections among the campus that all of those services actually are unified for us at this moment. But adding on that, I do want to ask a question about students' identity protection. Is all students' identity will be protected if they receive the services from the UHS?
Yes. They do. And we often, whenever I hold parent orientations, I let parents know there's a disclosure form that has to be signed. So information that is disclosed is only to those that are listed on that disclosure form. So should a student have a parent, guardian, friend, spouse, whatever that may be, they have to be listed on that for us to disclose any information, but they are protected by HIPAA.
Thank you. So I think our interview is coming to an end, but I do want to leave some space for you. If there is any final thoughts at this special time that you want our international students to know more about UHS.
I love to say, when in doubt, just give us a call. Right. So if you're not quite sure if it falls under the umbrella of University Health Services, if it's something that we can help you with, reach out. One of our great representatives will be happy to help you navigate the system. I know that it is a bit of a change going from dependent care to independent care. And navigating healthcare and insurance alone is very tricky. So we're here to help with that every step of the way. We have somebody in each area that is willing to reach out and to guide you through that, because ultimately the end goal is that you will gain a great knowledge, not only, in your academic studies, but to learn how to navigate healthcare on your own, and insurance. I will say our websites are very vast. So utilizing uhs.fsu.edu, studentinsurance.fsu.edu, chaw.fsu.edu. So using those websites, navigating through, and then picking up the phone or sending us an email. You can go right down to the bottom of the website. You can submit a feedback request, and that comes directly to me. So a lot of times I will reply back to you, or I'll send it to a department that would best be suited to answer that question. A lot of times I find that folks don't reach out because there's a breakdown in communication. Please know that we have folks in house that will help with the language barriers. So please utilize us or ask if you're having difficulty understanding. We have a resource for that as well. And I'd say just dive in, see what UHS offers. You'd be really surprised. I talked to a lot of students who are like, wow, I didn't know that UHS offered that. I know I didn't even touch on everything that we offer, just small pieces, but we definitely offer a lot to the students. So yeah.
Yeah. I also appreciate that you brought up and saying, like, if you contact that, like, click that icon email, the email actually just comes to me.
It
So
does. Yeah.
that is a part that we really feel like we really need to match the email address, that small icon, to a person, that international students can really have an idea about, oh, Mary is the one that I'm reaching out. So they feel like more connected and more close to you, and it will like decrease their like intimidation of really reaching out to UHS and getting services. So I really appreciated that.
Oh, absolutely. And my email address is mavant@fsu.edu. You can reach out to me. You don't have to scroll through that website to find that specific department. I will help connect you at all times. So never hesitate to reach out to me. I will always be that resource. So we can always start with me and go from there. I don't mind helping at all.
Thank you. Thank you very much today for taking your time and walking us through. Though it's a tiny part, but I know it's a very important part for us to start with. So thank you so much, Mary.
Absolutely. Thanks for having us.